Well, Madam Speaker, if I were Jewish, and sometimes I wish I were, I would be offended by the speech that we just heard that analogized male infant circumcision to stoning. We say they are absolutely, completely different in every possible aspect of the activity. We say there is a real imminent harm to a person who is being stoned as opposed to a baby boy who is having his foreskin removed. I'm going to be talking a lot particularly about the health benefits, of which we just heard a little bit from the Deputy Prime Minister, and also the various costs, or lack thereof, of male infant circumcision in a practical sense. But before I do, two issues of rebuttal. One, on this whole idea of religious freedom of both the parents and the child separately, and secondly, on parental rights. We say, firstly, this assertion that religious practices always change is perhaps true, but the fact of the matter is that there is a large sect of the community at the moment for whom this is still an important part of their cultural heritage. We say that whilst, no thank you, it's not acceptable in a lot of religions where once it were to stone adulterous wives, we say that it absolutely is vitally important to the actualisation of a large group of people in society, particularly Jewish people in modern Western liberal democracies. So we say for those people this religious practice is inherently, no thank you, important on two levels. Firstly, in terms of the actualisation of that individual within that community, and secondly, in terms of the community as a whole. And we heard Ab speak about both of those levels earlier on. We say to downplay the cultural significance of this is just downright offensive. To say that Jews aren't operating within a Dicks Out club is to miss the point, which is that this family knows, and this group in society knows whether that child has been circumcised, and knows whether they have been prevented under the government model from being circumcised, and are therefore living in sin, and are unwashed and unclean until the day of their 18th birthday, when they will presumably, Madam Speaker, go straight out and become clean, and be living with God, and be seeking salvation, which is something that they're, no thank you, unable to do within that culture, and are likely to be outcast from that group until they reach that age. So we say that that is absolutely an important part of this debate. Secondly, on this idea of the religious freedom of child, we say that's complete rubbish. There's no religion that holds up a hand like a bouncer and says no foreskin, no entry. We say that people can always decide a different religion down the track, and there is no religion, as Ab said, that isn't going to allow them in, no thank you, simply because they were raised as a Jew. So we call bollocks. Thirdly, on this issue of parental rights, and we heard this fantastic analysis towards the end of the Deputy PM speech, which was that, well, it's okay if they harm the mind of the child, but not the body, Madam Speaker, not the body. We say that's completely ridiculous. Firstly, we're not okay with people doing things like brainwashing their kids, but that doesn't mean we don't acknowledge as a society that parents are the best people to decide things to do with the child's mind. No, thank you. Like whether they get schooled at home or whether they get sent to a religious school, for example. But secondly, we say it's completely ridiculous to say that we don't allow parents to make decisions about the bodies of their children. Here's a few examples. One, contact sport. Should we stop allowing parents to make the decision that their child should play contact sports? Two, elective surgery. Should we stop allowing parents the ability to make decisions about their children in elective surgery? We say, thirdly, in terms of this whole issue of whether or not a child gets brought up as a vegetarian, we say there's probably an even more pertinent harm in modern society, which is where you have ridiculously obese parents who are feeding their children McDonald's. We say that's a lasting harm to that child, but nonetheless, we acknowledge that the parents are the best people to be making those decisions for that child. So for that important reason, I'll get to you in a moment, we say that parental rights are absolutely the most important part of this debate. Yes?
Are you happy with that Samoan family to give a child a tattoo for cultural reasons?
Yes, absolutely we are. For all the reasons that I just spoke about, while we're totally okay with like chopping off the tip of a kid's penis. We say that it's culturally significant for that group and it's a vital part of that culture. No, thank you. That child will be brought up in an environment that cares about them and be able to be a part of a wider group in society that acknowledges them as a member and acknowledges them as somebody who is following the cultural heritage of their ancestors. So generally in terms of substantive, I'm going to be having a look at the costs and benefits in a practical sense of male infant circumcision with a particular focus on the developing world. Firstly, let's have a look at the cost. Well, there are, in fact, very few. We think it's not at all analogous to female genital mutilation for a few reasons. One, we say that there's no removal of any sexual function, as there very often is with female genital mutilation. In fact, we see quite often that it actually enhances sexual pleasure for people who have been circumcised. We give you as evidence for that the fact that so many men go out voluntarily and get circumcised as much as possible and have their foreskin cut off so that the head of their penis is as tight as possible, Madam Speaker. So we say there are potentially benefits. We say any pain is very short term because it's a clinical procedure. Even if it's not a doctor doing it, we know that the rabbi has likely done thousands before, no thank you, and will know a way in which to do it with the minimum of harm. Then we look at the benefits, Madam Speaker, and this isn't about prostate cancer, no thank you. It's got nothing to do with prostate cancer at all. It's about sexually transmitted infections, and that's something that we recognise people can get below the age of 18. So we don't think it's enough to say, well, if there are health benefits, let's just let them do it the day of their 18th birthday. Here's what we're talking about, Madam Speaker. Uncircumcised males have about a 20% greater risk of getting an STI. That's not just about AIDS and HIV, Madam Speaker, it's also about other STIs. It's about herpes, it's about gonorrhea, and also those simple, curable STIs in the Western world, like the clap and like thrush and other fungal infections, Madam Speaker. We say that where you have an adequate supply of clean water when you're living in Australia, that's not so much of an issue. We say that the problem is when you're living in Africa, you're living in the developed world, and under the government's model, you can't be circumcised. The problem is that these simple conditions can turn into something far more sinister, Madam Speaker, and can cause this long-term damaging harm to the extent that somebody could lose all sexual function or even their life. We say this is particularly pertinent in the case of HIV, where people are doing everything they can to reduce the risk of HIV in these regions, only for the government to come along and say, no, you're no longer allowed to remove the skin at the tip of that young boy's penis, even though it's going to make him less likely to die an untimely death down the track, Madam Speaker. So because we say the costs of cutting off foreskins at a young age are so very small, Madam Speaker, and are not at all analogous to female genital mutilation in this debate, and because we say that the practical benefits are so great, particularly in the developing world, in the sense of preventing STIs from being transmitted by reducing the surface area of the soft tissue that comes into contact in intercourse, Madam Speaker. So because this debate isn't about mind versus body, because this debate isn't about prostate cancer, and because this debate is not about stoning or female genital mutilation, we are so proud to oppose.